Conway Medical Center and WPDE News Channel 15 present Your Health, Your Decision.
We are first and foremost, we're a surgical specialty. We go by a number of different names: ear, nose, and throat, ear, nose, eyes, and throat, which is an old name, otolaryngology, head and neck surgery. We also do facial plastics, but we are primarily a surgical specialty that deals with problems of the ears, nose, and throat. And that would include something as simple as placing ventilating tubes in a child's ears, performing major head and neck cancer surgery, tonsillectomy, adenoidectomy, nasal and sinus surgery, surgery on the voice box, endocrine surgery, which would include parathyroid and thyroid surgery primarily, any neck masses, and then we also do facial cosmetics. So we are all formally trained in facial cosmetics, so anything to do with forehead lifts, eyelid lifts, nasal surgery for cosmetic purposes, Botox injections, injection of dermal fillers, things like that. The latest technology that's come out within the past 3 or 4 years is something called balloon sinuplasty, or balloon sinus technology. And basically it takes the same principle as the cardiologists do with the heart arteries, where we insert a tiny catheter into the tiny openings of the sinuses. That's got a balloon on it that's a fairly rigid balloon, and we inflate it. And what that does is it opens up the natural opening to the sinus without taking out tissue, theoretically without causing scar tissue, so that you can get a nice result and alleviate patients' chronic sinus symptoms without destroying a lot of tissue, creating openings larger than you have to, and it can oftentimes be done in an outpatient setting. A lot of the problems we see are related to either chronic ear disease or chronic voice problems, chronic sore throats. One of the things that we oftentimes diagnose that hasn't been diagnosed up until we see them is chronic reflux. Now, people commonly think of reflux as being the heartburn and indigestion with the bloating sensation, but we see what's called extraesophageal reflux. We see the symptoms of a sensation of something stuck in your throat, feeling like you have to clear your throat a lot, so a lot of people attribute that to postnasal drip, when in fact it's actually coming from just thickened mucus in the back of the throat. Having to clear your throat a lot, particularly in the morning, a morning cough, sometimes choking at night while we sleep. Everyone refluxes to a certain extent, but people who have that extraesophageal reflux, they can have a lot of problems with their voice, with chronic sore throats, even with chronic ear pain that's actually referred from the throat being inflamed because of the reflux. We have the capability to diagnose that because we can pass a little flexible scope through their nose and actually view the voice box itself. So when we make that diagnosis, and there's a questionnaire that goes along with that diagnosis, we usually put them on reflux medicines and give them a reflux handout sheet and talk about what we think the cause is, and then we see them in follow-up to see whether it's cleared up.
For more information, visit us online at conwaymedicalcenter.com.